Deficiencies of certain antioxidants such as beta-carotene and vitamin B1 in cattle. So for vitamin A and beta-carotene deficiency, primary is an absolute deficiency and secondary is when there's maldigestion, malabsorption, or liver damage. For primary deficiency, this is from dried sugar beet pulp, poor quality hay, or high polyunsaturated fatty acids in the food, or a lack of colostrum in calves. The occurrence is overall rare due to a high amount of vitamin A liver storage. The signs are rare, but in mothers we can see calf blindness and an increase of infection, especially E. coli. And in adults we can see decreased reproduction, a retained placenta and decreased milk, as well as night blindness. And decreased immunity causes mastitis. If there is beta-carotene in the plasma, it becomes yellow. And for the treatment you give green fodder, beta-carotene, and a vitamin A intramuscular injection. If there's a B1 or thiamine deficiency, it causes polyoencephalomalacia. This usually happens in feedlots with bulls or sheep. It happens when the diet is high in grain, low in fibre, and high in sulfate. It can also happen when they eat thiaminase, which is in bracken fern, or if they have Clostridium. For the pathogenesis, increased lactate in the rumen causes an increase of pentote phosphate, which decreases the amount of ATP activity in the brain and lactate in the brain, and this causes intracellular edema and degeneration. And this results in cerebrocortical necrosis. And the clinical signs are blindness, seizures, and optotomus. For the treatment, you give a high dose of thiamine, which is vitamin B1, through IV, and you give glucose IV as well.